Now we're going to demonstrate to you a dynamic exercise for multifidi. So my client right now is self-contracting his multifidi, and I'm going to ask him just to, with one leg, his left leg, to lift it in extension, and bringing it down, making sure that multifidi is still being sustained in contraction. Now what we're going to do is demonstrate to you a functional exercise for TA and multifidi. So my client right now is standing with postural alignment right now. What I'm going to ask him to do is contract your abdominals, lean back towards the wall, having shoulders and lumbar spine directly on the wall. And what I'm going to ask you to do now is take about 3 paces out, holding that contraction, and back, to see if they're still holding that contraction. So for every strengthening exercise we perform today, they'll be done without any pain. According to the Merle's Guide, holding every contraction for 10 seconds, for 2 sets of 10 reps, for 1 minute in between each set, for 3 days a week, up to 8 weeks. What we're trying to accomplish here with all the clients is to relearn and sustain multifidi and transverse abdominis contractions during simple functional movements, starting with walking. We believe that it is an important aspect to core muscle rehabilitation for chronic low back pain. Clients with deconditioning or pelvic cross syndrome. Once we store strength and early activation of TA and multifidi, we can now safely move on and strengthening the superficial weak muscles and stretching the short muscles of the core. So now what we're going to demonstrate for you guys is an isometric, a dynamic, and a functional exercise to strengthen the core. So I'm going to ask my client to lie supine, okay, and to isometrically contract the abdominals. I'm going to ask my client to place his hands on his quads with his hips flexed. I'm going to ask him to contract and push into his quads while his quads are pushing into his hands. And as you can see the abdominals contracting, and the parameters behind that is 3 sets of 10, holding that contraction for about 15 seconds, 3 times a week, for up to 8 weeks. So now what we're going to do is we're going to demonstrate a dynamic exercise to strengthen the core. So I'm going to ask my client to put his hands behind his ears, and I want him to bring his body towards his knees, like so, in an isometric, eccentric, concentric contraction of the abs. I would prescribe my client to do this 3 times a day, 2 sets of 10 reps, up to 8 weeks. Now we're going to go forth and we're going to go into a functional outcome to still strengthen the abdominals. So I'm going to ask my client to pretend that he's going to be putting on his pants in the morning, as so, 1 leg at a time, or both legs at a time. And so, that way, we're still engaging the core. Now my client's going to demonstrate for you guys an isometric strengthening exercise for glute max. So can I ask you to lie prone for me, please? Hands on gluteus maximus, both hands please. With your knees flexed, and we want to contract gluteus maximus, so can I ask you to squeeze, please? And relax. And squeeze one more time. And perfect. You can see how it's gauging right now, gluteus maximus. Perfect. From that same position, we're going to demonstrate a dynamic strengthening exercise for gluteus maximus. Hands still on gluteus maximus, knees still flexed. Now what we're going to do is we're going to incorporate the extension of the hip. So with your left hip, can I ask you to extend it while in contraction of gluteus maximus? And down. And slowly back down to neutral. Perfect. Now we're going to demonstrate a functional exercise, strengthening exercise for gluteus maximus. So my client here is now going to stand sideline, and he's going to perform a squat. And before he performs that squat, I want to make sure that he understands that he still needs to be able to engage TA and multifidi, and also have a neutral L spine, and also have a neutral pelvic. And when you do your squat, I ask you just to have your hands out like so. Perfect. And bend the knees, making sure that he's still in neutral on both sides as L spine and pelvis is still neutral. Perfect. Parameters of the functional squat is 3 sets of 10 reps, 3 times a week, up to 8 weeks. Now we're going to demonstrate stretching exercises for the hip flexors. So my client is going to have his knees on the table, as like so. I'm going to make sure that my client has a neutral L spine and also a neutral pelvis. And then I'm going to coach my client to proceed going towards the table until he feels a gentle stretch. And hold that stretch. And back to neutral. The parameters for the stretch is to hold it up to about 30 seconds, 3 times a day, 5 days a week, up to 6 weeks. Now we're going to demonstrate a stretching exercise for the lumbar spine. My client now is lying supine on the table. What I'm going to ask my client to do is grasp his knees, like so. Slowly pull his knees towards his chest until you feel a gentle stretch in his lower back. You should feel no pain whatsoever in this exercise. If you feel pain, decrease how far you pull or make that stretch. Continue holding that stretch for 30 seconds. Repeat 3 times a day, up to 5 days a week, in a minimal 6 weeks. These stretches should be performed until the client feels a gentle stretch in the target muscle. Be sure that the client understands the difference between real pain and that should be avoided, and tissue stretch sensations that some clients might try to avoid. Next, we're going to demonstrate a functional integration, having my client pick up an object. So my client is now going to be picking up an object. We have to make sure and ensure our clients that he's making sure he has a neutral pelvic and also neutral L spine. And make sure as he is going into the squat that he's engaging TA and multifidi. So my client is now proceeding with the squat, making sure he's still in that neutral alignment, still engaging TA and multifidi, and my client is now going to lift the crate back to neutral and back down. And to the parameters of this exercise is to do 2 sets of 10 reps with 1-minute intervals 3 times a day up to 8 weeks. So when my client is free from chronic back pain and cleared to perform more challenging, more dynamic movements, they can enter the prehab phase of the home care.
Prehab is a term used to describe preventive exercises that will help maintain force couple balance to prevent hyperlordosis and avoid loss of neutral pelvic alignment. Preventing the downward spiral of low back pain, deconditioning syndrome, and pelvic cross syndrome is the objective here, and we're going to show you one example of a movement that involves these muscles. So what we're going to do is have Andrew get on the table on all fours, and he's going to slowly bring, before he starts moving, we're going to remind him to engage his multifidus muscles and his TA muscles to maintain neutral lumbar and neutral pelvic alignment. And then we're going to have him bring one knee up to his chest in a slow controlled movement. And he's going to use the abdominal muscles to hold the end of range position for one full controlled breath. After that breath, he's going to use the gluteal muscles to extend the hip without losing neutral lumbar position or neutral pelvic alignment. He's going to use the gluteal muscles at the end of that range and hold for one deep controlled breath. And then he's going to come back, put that knee back on the table, and then he's going to use the other leg. And that's going to be 1 rep. The parameters for this are 5 reps with each leg, 2 sets with a 2-minute rest in between each set, 5 times a week for 6 weeks. While this movement may be effective in preventing mechanical low back pain for many clients, each client is different, and we have to consider their ADLs when prescribing prehab exercises for them. I'm Mark.
I'm Andrew.
We want to thank you for watching our presentation on rehab and prehab exercises for low back pain. We hope we've shared something with you that will help you help your clients better to manage their own chronic low back pain.